Hi guys, welcome again to Intellect Medicos, where learning is made easy. First of all, congratulations guys, we are now 100k plus family on YouTube. Thank you so much for your love. On this occasion of 100k subscribers, we have 3 good news, or you can say gifts for you. I'll unwrap the first gift after exercising first ECG question, second gift after the third ECG question, and third gift at the end of this video. So do watch this video till the end. So now let's start with 5 ECG questions which you commonly come across your clinical practice or in your medical examinations. Before starting, I presume that you have gone through our first ECG video, which now has 2 million views, as that video will help you solve some of today's questions. So question number 1. A 70-year-old man came to emergency with chest pain and sweating all over the face. An ECG was taken upon arrival. What does this ECG shows? Now pause this video and try to interpret this ECG. If you know the answer, that's superb, amazing. We have some interesting and difficult ECG for you guys in later part of this video. Just wait. Whereas, if you are not able to interpret, don't worry my friend. We are here to help you out. Before interpretation, first of all, check the calibration of ECG machine. The speed should be 25 millimeters per second. Now step number 1. As RR intervals are same, rhythm is regular. Step number 2. Calculate the heart rate. Formula is 300 divided by number of large boxes between two RR interval. In this ECG, there are approximately 4 large boxes. So 300 divided by 4 comes out to be 75 beats per minute. Step number 3. Axis determination. Net QRS deflection is positive in both lead 1 and AVF. That means normal axis. You can learn the concept behind axis determination in our first ECG video. Step number 4. P wave. It is normal in size and shape and is present before each QRS complex. Step number 5. PR interval. It is normal. Step number 6. Q wave. It is present in lead 2, 3 and AVF. Step number 7. QRS complex. It is also normal. Step number 8. QT interval. It is also normal. Step number 9. ST segment. You can see elevation in lead 2, 3 and AVF, suggesting inferior wall MI. Also you can see there is ST depression in V1 and V2. So along with inferior wall MI, there is posterior wall infarction too. So now coming to step number 10, T wave is also normal. So this patient has inferior wall STEMI, that is ST elevation MI with posterior wall extension. As discussed at the start of this video, now it's time to reveal our first gift. You guys will be amazed, happy to know that we have made our official website for you guys, on which you can find daily MCQs, interesting mnemonics, blogs, motivational quotes and many other interesting stuff. I have given the link in the description. Also, we have recently started our Instagram page, intellect.medicos, on which we post MCQs each and every day. Now without wasting any more time, let's move to our second ECG problem. Question number 2. A 35-year-old woman comes to emergency with complaints of dizziness. What is the abnormality shown in this ECG? Now again, pause this video for a while and try to interpret this ECG step by step as explained in my first ECG video. this is a very easy example. Let's interpret it together now. Rhythm is regular, rate is 300 divided by 4, that is 75 beats per minute. Normal axis, as both lead 1 and AVF are in same direction. Normal size and shape of P wave, PR interval more than 200 milliseconds or more than 0.2 seconds. That means it is prolonged and it is fixed. QRS complex narrow, QT interval, ST segment and T wave all are normal. As there is constant prolonged PR interval, this suggests first degree heart block. Coming on to question number 3. A 22-year-old student complains of episodes of palpitations, dizziness and chest pain. What is the abnormality in this ECG? Again, pause this video for a while. Now let's read it together. Regular rhythm, rate 75 beats per minute, normal axis, normal P wave, short PR interval, wide QRS complex with slurred upstroke of QRS called as delta wave, and T wave is normal. So this patient has accessory pathway as there occurs early activation of ventricles due to impulses bypassing the AV node via an accessory pathway. This patient is having WPW syndrome, that is Wolff-Parkinson-White syndrome. We have finished with our third ECG example. Excited for the second good news? So okay, on the basis of multiple requests and queries from all of you guys, we are coming up with an ECG course. In this course, there will be 10 to 12 modules explaining the concepts, basics and advanced ECG rhythms. There will be practice questions at the end of each module, and after completing all the modules, you will receive a completion certificate from Intellect Medicos. And most importantly, we assure you that at the end of course, you will have in-depth knowledge of all the ECG rhythms, and you will be able to interpret all sort of ECGs which come across in your clinical practice or in various medical examinations. Do not forget to watch our last gift for you guys. Now coming on to fourth question. A 40-year-old female has to undergo lap cholecystectomy. She is diabetic and hypertensive. You ask for an ECG before the surgery. What is the abnormality seen in this ECG? Again, pause this video. Try to interpret on your own first. Now let's interpret it step by step. Regular rhythm, rate is approximately 75 beats per minute. Left axis deviation, as you can see, lead 1 and AVF both are going in different directions. So remember, whenever they leave each other, then it's left axis deviation. There is normal P wave and normal PR interval. S wave in V1 or V2 plus R wave in V5 or V6 is more than 35 millimeters. There is also ST depression and T wave inversion in lead 1, AVL, V5 and V6, suggesting LV strain. That means this patient has left ventricular hypertrophy with LV strain. I hope you are enjoying this ECG practice. Now coming on to next question and the last question, that is question number 5. A 40-year-old male was rushed to emergency after his car accident. Patient is drowsy, heart rate is 130 per minute, blood pressure 80 by 50 millimeters of mercury, respiratory rate 22 per minute. An ECG was done. What is the abnormality in this ECG? Leave your answers in the comment section below. To check the full explanation to this question, click on the link. Hey wait, there is one more gift left for you guys. We will give this ECG course free to 3 lucky winners. The only thing you need to do is to comment whether you want this course or not, and to share this video with your colleagues on different social media platforms like Facebook, YouTube, Instagram, Twitter. The more you share, more will be your chances to win this ECG course for free. And send us the screenshot on our email ID dr.intellectmedicos@gmail.com. We will announce the name of winners on 26th of July, that is on Sunday. Thank you so much guys for watching this video and for supporting us. Good luck. Bye bye.